Hi students, today we are discussing all the imaged based questions which I have posted on your Instagram page. So there were total 100 questions. I have given the PDF for you. So in this session, I'll be discussing all the questions in a rapid mode. I'll be covering all the keywords of your imaged based question. Question number 1 which was posted was showing the interaction between three factors: agent, host and environment. So what is this called as? This is your epidemiological triad. Epidemiological triad interaction takes place in pre-pathogenesis phase. Natural history has two phases: pre-pathogenesis and pathogenesis. Pathogenesis has two phases: early pathogenesis and late pathogenesis. Once there is interaction, that is epidemiological triad. Once the interaction is successful, once the interaction becomes successful, then there is disease formation. Initiation of disease and progression will be seen in pathogenesis phase, but the initial part of interaction is seen in pre-pathogenesis phase. Good. So coming to the second question, the image is related to spectrum of disease. What you are seeing here, it is iceberg phenomenon of disease. Which disease will not show submerged portion? Answer is tetanus. Has no chronic carrier state. We have an MCQ saying which has no submerged portion. The mnemonic is MTR. Measles, tetanus, rubella and rabies has no chronic carrier state. No submerged portion. When the question is on submerged portion, you have to answer based on chronic carrier state. MTR has no chronic carrier state. Measles, tetanus, rubella and rabies. Remaining disease will show submerged portion like polio, protein energy, malnutrition, nutritional deficiencies, leprosy and even mental health disorders. Those they will be having a huge submerged portion. Answer is tetanus, no submerged portion. The next question was epidemiological wheel theory of disease formation. We have endogenous factors and exogenous factors. Inner circle is for endogenous factors, outer circle is for exogenous factors. What is the contribution of biological factors, social factors and physical factors, physical environment? Inner core represent what? That was the question. The outer core represent exogenous, BSP, बहुjan Samaj Party, biological factor, social factor, physical factor. But the inner core represent genetic component. Option D is the answer. This will be the question. Inner core represent endogenous factors, genetic factors. Come to the next question. The image shown below is related to web of causation. You can see the interrelating factors. This is web of causation. True regarding the interpretation of this. One-to-one causation, no. It is multifactorial etiology with interrelationship among the factors. Used for infections only, no. Non-communicable chronic diseases mainly will exhibit such sort of web of causation. Cannot be used for non-communicable disease, no. Can be used. The answer is complex interrelationship. Remember the keyword complex interrelationship between the multiple factors responsible for disease formation, used only for chronic non-communicable or mainly for chronic non-communicable diseases. See the question. The next question is telling spread of disease in a completely susceptible population. See the keywords. Spread of disease in a completely susceptible population. Your answer is basic reproduction number. Your answer will be basic reproduction number, indicating the spread of disease. On an average, one case can present how many cases? See, for example, one case is leading to two cases in the community when everyone is susceptible. This is an example, and this is the definition of basic reproduction number. If it is more than one, it leads to epidemic. So on an average, one case can produce how many cases in the community in a completely susceptible population. If the community is not susceptible, in a mixed population, how many cases one case can produce? Then your answer is effective reproduction number. Means the difference. Basic reproduction number is for the whole completely susceptible population. Effective reproduction number is for the mixed population. Answer is option B, since the word completely susceptible population was given in the question. Come to the next question. See this question good. The image shown below represents to period of epidemiology. Duration B represents. If the question is like this, duration B represents means, listen, From year to year, it is minimum incubation period. From the exposure to 50% of the cases, this is the question, from the point of exposure to 50% of the cases. So the answer will be median incubation period. So what is the definition of median incubation period? Right from the point of exposure to 50% of the cases. This was the question. So if the whole wave represent 100%, 50% case lie this side, 50% case lie the other side. Question is on exposure to 50% of the cases, median incubation period. Good. See the next question. There is person to person spread. One individual leading to one more individual. As you can see here, there is person to person spread of cases. The epidemic will continue in propagation. The answer is propagated epidemic, responsible for person to person transmission. Like polio can show this. Even hepatitis B in the books, hepatitis B in the books, what they have given is propagated epidemic. Always remember the word P for propagation, P for person to person transmission. They will give this image for you and they will ask what is this type of epidemic. What is the example? Propagated epidemic. Could come to the question. As you can see here, it is spot maps indicating what? Place distribution of disease, which area is affected more comparatively. Spot maps will indicate place distribution of disease. The question was, which of the following is true? Time distribution, no. Severity of cases, not related. Place distribution, correct. Cannot indicate clustering, wrong. It can indicate which area is affected. Clustering can be seen. For time distribution, we have epidemic curve. So what is used for time distribution? Curve, an epidemic curve indicating the time with respect to time, how the cases are increasing. Place distribution, spot maps. Keep this in mind. Very good. Come to the next question. False statement for the image shown below. See the word. This is one wave. All the cases happened within one incubation period. So it is not an epidemic curve. No, it is an epidemic curve. X-axis will be time. Y-axis you are showing number of cases. Time and number of cases, epidemic curve. Place distribution, no, it will indicate time distribution, not place. Depicting multiple source outbreak, no. One wave, one source, single source, point source epidemic. Answer is all of this. Everything is false. Very important question. It is an epidemic curve representing single source, point source epidemic. See the question. Depicting the change in the pattern of non-communicable diseases over time. What is this trend called as? Long-term fluctuation. Answer is secular trend. Example, epidemiological transition. Increase in the trend of non-communicable diseases. Increase in the trend of non-communicable diseases compared to communicable disease. This is showing epidemiological shift in the pattern of diseases, also known as long-term fluctuation, secular trend. Keep this in mind. All these are repeat. Very important question. Come to this image. Vaccine related question. It is BCG vaccine. What is true for this? I'm giving true statement, not false. 0.5 ml subcutaneous, no, it is 0.1 ml intradermal BCG vaccine. Side effect brachial neuritis, no, brachial neuritis is for tetanus toxoid. BCG can cause suppurative lymphadenitis or disseminated BCG infection, or it can also cause BCG osteitis. Lyophilized, yes, but diluted with PBS, no, it is diluted with normal saline. PBS is the diluent for Japanese encephalitis vaccine. Good. Prevent severe forms of childhood TB, yes. The only important use, it can prevent mortality. Miliary TB it can prevent, that is correct. And also meningitis it can prevent, that is also correct. These two M's you have to remember, miliary TB and meningitis. That is the role of giving BCG vaccine. Come to the next question. Good. We are going in ultra rapid mode because as promised I will cover all the 100 questions in 45 minutes. That will save your time and my time. It will be more efficient enough. Good. Which of the following is true for the vaccine shown below? Hepatitis B vaccine, very important. Given at 9th month? No. It is given at birth within 24 hours and also as a part of pentavalent vaccine at 6, 10 and 14 weeks. as a part of pentavalent at 6, 10 and 14 weeks. 0.5 ml subcutaneous, no. It is given intramuscular route at birth. Given for high-risk infants only, no. It is for all the newborn in our country, good. Should be given within 24 hours of birth, that is correct, very very important. To prevent perinatal transmission, it has to be given within 24 hours of birth. Come to the next question. Measles vaccine given at third month under NIS, no. It is at ninth month, and the second dose it 16 to 24 month. How many doses? 2 doses. Some states they are using MR vaccine. Measles has been totally replaced by MR vaccine in some selected states. 0.5 ml intradermal, no, it is subcutaneous. Subcutaneous. Efficacy after 2 doses 65%, no, it is 95%. Very important number. In order to eliminate measles, we need 95% efficacy. So 2 doses of measles vaccine. Side effect toxic shock syndrome, correct. Toxic shock syndrome can also be seen in BCG vaccine, but usually seen and more frequent for measles vaccine compared to BCG vaccine. Good. Note all my keywords what I am telling, very important. Good. Which of the following is false for the vaccine shown below? MR vaccine. The question is false. Replaced measles vaccine in selected states, correct. Second dose at 16 to 24 month, correct. First dose at 9th month. Catch-up campaign in the age group of 9 months to 15 years, this is also correct. Catch-up campaign was done long back. So it was initially done long, maybe 3, 4 or 5, 6 years back, where one dose was given between 9 months to 15 years. That was done all over the country. Now we are not having any catch-up concept. Only during outbreak you can give MR vaccine, but we don't have any catch-up concept. This is very old thing, but you should know the age group of catch-up campaign. Not a part of Mission Indradhanush, wrong. It is a part of Mission Indradhanush, means we are having MR vaccines in the national schedule also. Very good. Come to this question. Which of the following is true for IPV vaccine? So IPV vaccine is given at 18th month, no. The first and second dose at 6 and 14 weeks. Now the third dose is given at 9th month. This is one addition in the schedule. Fractional IPV dose 0.1 ml intradermal. This is correct. So it is intradermal 0.1 ml. So in the initial 2 doses it is given in right deltoid. After that it is given in left deltoid. So remember this. The initial 2 doses in right deltoid. After that at 9th month it is given in left deltoid. Bivalent IPV is used. No. It is trivalent what we are using. And side effect is VAP. No. VAP is the side effect of oral polio vaccine. Live attenuated vaccine OPV can cause vaccine associated paralytic polio. VAP is the side effect of OPV, not IPV. Answer is option B. Fractional IPV is given 0.1 ml intradermal. Which of the following is true for the vaccine shown below? Pneumococcal conjugate vaccine 13, PCV 13, what is shown in the image? It is saying which of the following is true. Prevents meningitis? No, it has nothing to do with meningitis. It can prevent pneumococcal pneumonia. 0.5 ml intramuscular, correct. The dose is 0.5 ml intramuscular. So 2 doses at 6 and 14 weeks. Booster at 9th month. 2 doses at 6 and 14 weeks. Booster at 9th month. PCV 10 is used under NIS, no. As you can see in the image, it is PCV 13. PCV booster is not under NIS, no. There is PCV booster at what age? 9th month. Very good. 17th question. Which of the following is true for the vaccine shown? It is pentavalent vaccine. Pentavalent vaccine. True, they are asking. 0.1 ml intradermal? No. 0.5 ml intramuscular. First dose at 9th month? No, it is at 6, 10, 14 weeks. Upper limit for first dose 5 year? No, it is 1 year for the upper limit of first dose. Listen to my words properly. Upper limit of first dose is 1 year. And what it can prevent? Diphtheria, pertussis, tetanus. Hepatitis B at the same time pneumonia and meningitis due to hip component. Pneumonia and meningitis due to hip component. Option A is correct. It can prevent meningitis. What component can prevent meningitis? Hib. Haemophilus influenza B within pentavalent. Which of the following is true for the vaccine shown below? Except means which is false. True except question. 3 doses 6, 10, 14 correct. Rotavac is used. 5 drops oral correct. Side effect interception correct. Booster at 9th month? No, there is no booster doses of Rotavac. There is no booster doses of Rotavac. Which of the following is true for the vaccine administered as shown below? As shown below, it is Japanese encephalitis vaccine. As you can see here, it is given 0.5 ml subcutaneous left fold. 0.5 ml subcutaneous left fold. It will prevent aseptic meningitis? No. It can prevent Japanese encephalitis. 0.5 ml intramuscular? No, it is subcutaneous. Used in all the states? No, only endemic states. First dose at 9th month correct. Second dose in between 16 to 24 month. Only in endemic state. 2 doses. First dose at 9th month. Second dose at 16 to 24 month. Which of the following is true for the vaccine? Again, you can see the question. It is TD vaccine. TD vaccine. Which of the following is true related to this vaccine with respect to pregnancy? That is the keyword. Take the question. Keyword is pregnancy. What we are doing, listen now, option D is correct. 2 doses at a gap of 4 weeks. If there is a new pregnant, she will get 2 doses. 1 and 2. The gap between them is 4 weeks. This is for a new pregnant. If any pregnancy happens after this, within 3 years, if she becomes pregnant, she has to take booster. So option D is correct. What is the role of booster? For a pregnant who has been vaccinated before and pregnancy happens within 3 years. The keyword is 3, not 5. The keyword is 3 years, not 5 years. Then we can give 1 dose of booster. Which of the following is true for the image shown below? See this. What they are showing is vaccine while monitor. So VVM directly indicates efficacy of vaccine? No, not direct indicator. Freeze exposure? No. Heat exposure. Vaccine is used if VVM is in stage 3 and 4? No. 1 and 2 you can use it. This is in stage 4. Yes, correct. You can see the square, it is darker. So listen, VVM stage 1 and 2 it is good and you can use it. Stage 3 is equal. Stage 4 which was shown for you is darker. 3 is equal, 4 is darker. Should not be used in 3 and 4. Can be used in 1 and 2. It can indicate what exposure? Heat exposure, not freezing. Shake test was done on a suspect vial to check for freeze damage. Highlight the keyword. Shake test will indicate freeze damage. That is correct. Based on the findings shown below, what is your inference? Always remember, shake test we check the rate of sedimentation. If the sedimentation in the test vial, what you are seeing is faster, as you can see the sediments, it is faster. The vial is damaged. The test vial is damaged and you have to discard the vaccine. Test vial is damaged and you have to discard the vaccine. Just in a rapid mode, I'll be telling what are you supposed to do in shake test. We take 2 vials, control vials and test vials. We just shake it and we just keep it on the table. When it is inverted, we check the rate of sedimentation in both the vials. If the rate of sedimentation is slow, use it. If it is fast or at the same rate, the vial is damaged, discard it. Repeat, if it is slow, use it. If it is fast or at the same pace, discard it. What you are checking in shake test? Rate of sedimentation. Remember the keywords. Rate of sedimentation. Good. When you are supposed to discard, like this, if they show the image, if the rate of sedimentation is faster compared to control vial. So what are you comparing with? You are comparing with control vial. So then what you are checking? Rate of sedimentation. See the table. If it is slow, use it. If it is fast or at the same rate, you have to discard. Option A is the correct answer. Very good. Come to this and tell me the true statement for Iceland refrigerator. Used in sub-centers, no. From primary health center and above. Last storage point is primary health center. Temperature minus 15 to minus 25. No, it is 2 to 8 degree. PHC is the last storage point. Yes, correct. Agreed. Hepatitis B at the bottom. No, at the top. At the bottom we are keeping OPV. At the top we are keeping hepatitis B. Why hepatitis B at the top? Most free sensitive vaccine. Most free sensitive vaccine is hepatitis B. Good. So the question next what I am showing is conditioning of ice packs. Conditioning of ice packs means you bring the frozen pack, keep it outside, and you see the droplets, or 10-15 minutes you will see that sweating of ice packs. Sweating of ice packs is very important to avoid damage to free sensitive vaccine. If I am keeping free sensitive vaccines in the vaccine carrier, if there are frozen ice packs, it will damage my vial. It will damage my vial. So conditioning is done to prevent damage to free sensitive vaccine. Answer is DPT. T series like DPT, TT, Penta, Hepatitis B. DPT, TT, Penta, Hepatitis B. These are important free sensitive vaccine. OPV, BCG and measles, these are not free sensitive. These are heat sensitive. Remember the words. These are already lyophilized freeze dried like BCG, measles. OPV is also not free sensitive. Repeat, free sensitive DPT, TT, Penta, Hepatitis B. Not free sensitive BCG, measles and oral polio vaccine. All of the following diseases are included under Mission Indradhanush except, so which is not a part of Mission Indradhanush. So my answer is yes, good. Mumps is not included. We have MR, not MMR. M for measles, R for rubella, not measles, mumps, rubella. So what are the diseases prevented? So now answer my question. Childhood TB, BCG will prevent this. DPT, pertussis, tetanus, we have DPT vaccine. Polio, hepatitis B, pneumonia and meningitis due to Hib, which is a part of pentavalent. Measles, rubella, G and rotavirus. Total how many diseases? 12. Initially it was 7, now it is 12. जब लॉन्च हुआ था उस टाइम पे 7, नाउ इट इज 12. मिशन इंद्रधनुष will target how many vaccine preventable diseases? Answer is 12, not 7. It has been updated to 12 vaccine preventable diseases. Good. Which of the following is true for the image shown below? What they're showing a vial, vaccine vial, which has been opened and the date and time is mentioned. So the question will be on open vial policy. Open vial policy is applicable if date and time is not mentioned. No, if mentioned, then only it is applicable. Is not applicable if VVM is intact. No. Open vial policy is applicable only if VVM is intact. Open vial policy is applicable for IPV. Correct. It can be used in the next session. Open vial policy is not applicable for pentavalent. No, it is also applicable for pentavalent. So it is not applicable for BCG, measles, GE, Rotavac and COVID related vaccine. Remember, not applicable for BCG, measles or MR, GE, Rotavac and Covishield and Covaxin. These cannot be used in the next session. Remaining all the vials can be used in the next session. For how many weeks? For 4 weeks. What are the conditions? Date and time should be mentioned. VVM should be intact. VVM should be intact. So see the correlation what they are showing. Per capita meat consumption and colon cancer. So what they are showing is correlation. So the correlation what you are seeing is positive correlation at a group level. Which of the following is false? The study is ecological study, correct. Study correlation, correct. Unit of analysis, group level, correct. Results are applicable at individual level? No. The results can be applicable only at group level. It is ecological study. Which of the following is true for the image shown below? Cases and controls what they are taking. It is a case control study. It is prospective. No, it is retrospective. Odds ratio is less than 1. No, you can see here, if I can say A, B, C, D, odds ratio will be cross product AD by BC. When you take it is 9, it is more than 1, it is protective. No, drug abuse, if it is more than 1, odds ratio is more than 1, the exposure is a risk factor, not a protective factor. In order to check the significance of association, we are using chi-square test. Chi-square test can indicate significance of association. Which of the following is false for the image shown below? It is a retrospective cohort study. As you can see, they are taking the records and they are doing follow-up, calculating incidence and calculating risk ratio. It is a record based study, saving time and cost, same to same as cohort study, done with existing records, save time and cost, risk ratio indicating strength of association, correct. Temporality is absent, no, there is temporality. Exposure to outcome, what you are checking here, but with the help of records, not a concurrent cohort study. It is a retrospectively done cohort study having all the properties of cohort. Follow-up is done, risk ratio is calculated, temporality is also present. Which of the following is false for the image shown below? As you can see here, exposed group, non-exposed group. Exposed group is having less risk compared to non-exposed group, means antioxidants is protective. Antioxidant is protective. As you can see, their incidence in exposed is 20 by 4000. Incidence in non-exposed is 40 by 4000. So when you take the ratio, it is half. Risk ratio is 0.5, less than 1, less than 1. It is a protective factor. It is a protective factor. Risk ratio is 1, no. Positive association, no. More than 1, no. It is less than 1, and negative association means protective factor. Less than 1 and negative association, protective factor. Which of the following is true for the image shown below? Phase 1, phase 2. We are keeping a gap in between washout. Then we are interchanging the intervention. This is crossover RCT. It is not a crossover RCT. No, it is crossover. Dropouts cannot be seen. No, you can see dropouts because there is follow-up. Patients will receive intervention only. No, they will receive intervention in phase 1. The same set will receive placebo in phase 2. Those who have received placebo in phase 1 will receive intervention in phase 2. That is what we are interchanging. Not suitable for self-limiting illness, correct. If the disease is curable in phase 1 itself, there is no point of exchanging and keeping the patient in phase 2. That is why it is used only for chronic non-communicable diseases, chronic diseases, not suitable for acute illness, not suitable for acute illness. So all these are rapid revision sessions. So it's an ultra rapid mode what I am going. You have to revise your notes and apply this concept. We have posted all the questions on Instagram page. I've given the PDFs also. This video is helping just to save your time in an ultra rapid mode. I'm going and revising this for you. Which of the following is not false means which of the following is true? Centripetal distribution, pleomorphism, all these are features of chickenpox. So it is not communicable. No, it is communicable. The rash is not pleomorphic. No, it is pleomorphism. What you are seeing, different stages of rash. Live vaccine is used for prevention, correct. Oka strain is used for prevention. Rash involve palms and soles. No, it is not outward. It is not centrifugal. It is centripetal distribution. The density is more in the trunk. Good. Come to the next question. Again, the question is not false. What you're seeing Koplik spots. Koplik spots. Rash is retroauricular behind the ear, where it starts. It is measles. More common in males. No, it is equal incidence in males and females. Koplik spots are seen in eruptive stage. No, it is seen in prodromal stage. Most common CNS complication is encephalitis, correct. Most common is encephalitis. Most specific is SSP. Both are different. Most common is encephalitis. Animal reservoir seen? No, there is no animal reservoir. Very easy to eliminate. Man is the only host for measles. Which of the following is not false for the infection shown below? Japanese encephalitis. See, you can see bird, mosquito and pig. Bird, mosquito, pig, Japanese encephalitis. Birds are amplifiers? No. Pig is the amplifier. Pig manifests symptoms? No, they are asymptomatic. Man is accidental dead end host? Correct. There is no further transmission. Man is accidental dead end host. This is correct. 17D strain is used for prevention? No, it is not 17D. It is SCA 14-14-2. 17D is for yellow fever. SCA 14-14-2 is for Japanese encephalitis. Which of the following is false for the infection shown below related to the images? What you can see is chigger mites and you are seeing eschars. It is scrub typhus. What you are commenting on? Scrub typhus. Vector is Hartic. No, it is trombiculid mite. The larva is called as chigger mite. Rash involves palms and soles. No, there is no involvement of rash at two palms and soles. You can see dark thick lesion indicating the site of bite, eschar. Wheel Felix reaction, ox K19. No, it is ox K plus reaction. Ox K plus reaction. So all these are false statement. Answer is all of the following are false statements. So which of the following is the vector responsible? Inguinal buboes, what you are saying, it is bubonic plague. Bubonic plague. Vector is phlebotomus. No, answer is wrong. You are marking. Vector is not phlebotomus. Vector is plague, rat flea. Xenopsilla cheophis is the vector for bubonic plague. Rat flea, Xenopsilla cheophis. What you are seeing, bats, and they are giving hemorrhagic manifestation. Bats and bleeding, if both are given in the option, answer is Ebola, not Nipah. Bats and encephalitis is Nipah. Bats and bleeding, then you have to answer it as Ebola hemorrhagic fever. But in the next question, acute encephalitis after exposure to bats. This was the life cycle given. Bats and encephalitis is Nipah. What is bats and bleeding? Ebola hemorrhagic fever. What is bats and encephalitis? Nipah. Acute encephalitis is Nipah. Ebola presents as hemorrhagic fever. Which of the following is the cycle? Like they are showing a cycle responsible where Arctic is also involved. Cattle is the reservoir where those who are involved with cattle will have fever, rash, joint pain. Where vector is Arctic. Answer is going in favor of CCHF. Crimean Congo hemorrhagic fever. What is the reservoir? Cattle, even camels can be the reservoir. But what is the vector? Arctic. How they present? Viral hemorrhagic fever. CCHF is very important. See this important. Where there is mother to child transmission, the question was on Zika. You have microcephaly congenital manifestations after exposure to Zika virus. What is the vector responsible for Zika? What is your answer? Aedes. Option D is the correct answer. Vector for Zika is Aedes. Which of the following is true for the blister pack shown below? 3-FDC. Fixed dose combination is HRE. This is used in continuation phase. What is used in intensive phase? HRZE plus HRE. 2 months of intensive phase, 4 months of continuation phase. So it is used in intensive phase. No. Thambutol is not used. No, it is used. Fixed dose combination is not used. No, it is used. Number of tablets per day, since it is fixed dose combination, the parameter what we decide is based on body weight of the patient. Write this HRZD plus HRE. How you manage a case of TB? Daily regimen 6 months, 2 plus 4. Ethambutol is also used in continuation phase. Which of the following is true for the strategies shown below in the program? It is National TB Elimination Program logo what I am showing. Active case finding is not done. No, it is done in vulnerable population. TB notification is mandatory. If they say not mandatory, no, it is mandate. Notification is done under Nischay. No, it is Nikshay. Don't make mistake. Website of TB is Nikshay, not Nischay. Cash incentives is given. Yes, this is Nikshay Poshan Abhiyan or Nikshay Poshan Yojana, where the patient will get 500 rupees per month during treatment. 500 rupees per month during treatment. This is Nikshay Poshan Yojana or Nikshay Poshan Abhiyan. Not an objective of RKSK. Remember, which is not an objective of RKSK. Mental health, yes. Substance abuse, yes, we have to prevent. Gender based violence, we have to avoid. Vocational skill education is not a component. Remember, mental health, substance abuse, gender based violence. Along with this, we have to promote nutrition, we have to reduce non-communicable diseases, and we have to reduce sexual health issues. So mental health 1, substance abuse 2, gender based violence 3, promote nutrition 4, reduce non-communicable disease 5, reduce sexual health issues 6. Total 6 objectives under Rashtriya Kishore Swasthya Karyakram, not included under JSSK. JSSK has diet, drugs, diagnostics, transport facility, drawback is also available, cesarean section. So we have discussed a mnemonic: diet, drugs, diagnostics, T for transport, C for cesarean section, DTC. Diet, drugs, diagnostic, transport and cesarean section. Diet, yes. Exemption from user charges, yes. This is also a component. Free drawback facility, yes. Health insurance for life, no, it is not. Not life, SBI life insurance, nahi hai, it is Janani Shishu Suraksha Karyakram. Which of the following is correctly matched for the stickers used under this scheme? PMSMA scheme, Pradhan Mantri Surakshit Matritva Abhiyan. Orange, high risk pregnant, no. Green, hypothyroidism, no. Yellow, STI, correct. Blue, obesity, no. There are 4 stickers. See here: green, no risk factor; red, high risk pregnancy. Green, no risk factor; red, high risk pregnancy. Blue, very important, PIH. Yellow sticker, yellow, dirty fellow, underline this: diabetes, hypothyroidism and STIs. So what are the stickers used? Green, red, traffic signal; blue, blood pressure, PIH. Yellow is very important. Here you make mistake. Underline Chennai Super Kings, very important: diabetes, hypothyroidism and STIs. Which of the following is the purpose of the scheme shown? It is Lakshya scheme, beta. Good. It is LQ, labor room quality. सब कुछ words के अंदर है, देखो. Labor room quality. Where is the option? Here is the answer. Labor room quality, right from community health centers and medical colleges. Labor room quality has to be improved. That is Lakshya scheme. Indian newborn action plan, the target was the question: single digit neonatal mortality rate. Always keep this in mind. It is single digit neonatal mortality rate and also single digit stillbirth rate. So where is your answer? Single digit neonatal mortality rate or single digit stillbirth rate by the year 2030. This has to be achieved at national level. So I'll be searching my answer. More than 10, 2030, no. Less than 10, 2025, no. Stillbirth to single digit, yes, option D is correct. So single digit neonatal mortality rate, single digit stillbirth rate by the year 2030. That is a target of INAP. Which of the following nutritional deficiency is not screened under Rashtriya Bal Swasthya Karyakram? So zinc is not screened. A, goiter and SAM will be screened for. So what are the nutritional deficiencies screened? Anemia, vitamin A, vitamin D, severe acute malnutrition and goiter. So when I'm giving the PDFs for you, I'm giving the list of other diseases, but in this nutritional deficiencies are repeatedly asked. Very important in the table. What is this scheme? Screening Rashtriya Bal Swasthya Karyakram. Which of the following is used to eliminate filariasis? Elephantiasis, filariasis. What we are using? We are using a triple drug regimen, that is ivermectin, DEC, albendazole. Ivermectin, DEC, albendazole at mass level in endemic areas. This is triple drug therapy. to eliminate filariasis. Triple drug therapy to eliminate filariasis. So which of the following rapid diagnostic kit is used to diagnose Kala Azar? Endemic areas, what kit is used for diagnosing Kala Azar? Answer is RK39. One drop of blood. If it is positive, start treatment. Drug of choice is LAM, liposomal amphotericin B. What is the diagnostic kit? RK39. What is the drug of choice? Liposomal amphotericin B. So the next question on HIV management in pregnancy. So what is the logo given? It is for PPTCT, prevention of parent to child transmission. The question was, what is used in pregnancy for HIV management? We are using tenofovir, lamivudine and dolutegravir. TLD combination is used. Before TLE was used. Now it has been replaced by TLD combination. Start TLD in any trimester irrespective of CD4 count or gestational periods. It is dolutegravir in place of efavirenz. Previously efavirenz was used. This will be the second line. The preferred choice is TLD in pregnancy. Newborn we are using nevirapine. So which of the following is true for the MDT pack shown below? It is leprosy treatment pack what is shown for you. It is red color pack what we are using in both posse and multibacillary leprosy. Possibacillary leprosy 6 months of treatment, multibacillary leprosy 12 months of treatment. This is the newer update. It is used to manage malaria, no leprosy. 6 packs are sufficient to manage a case of multibacillary leprosy, no. Posse it is 6, multi it is 12. Rifampicin is used daily, no, it is used on day 1. Day 1 when the patient comes to you, you are using rifampicin, clofazimine and dapsone. For the remaining days, clofazimine and dapsone. So day 1 rifampicin, clofazimine and dapsone. For the remaining days, clofazimine and dapsone. You can see here it is 3 capsules of rifampicin, 2 capsules of clofazimine and 1 tablet of dapsone RCD. For the remaining days, dose of clofazimine will be lesser and we are using dapsone. So like this we have red packs, 6 packs for posse, 12 packs for multi. So clofazimine is a part of management, that is the only correct statement. The next question on ICDS scheme. This is the logo for ICDS, Integrated Child Development Scheme. Anganwadi centers. It is under Ministry of Health and Family Welfare, no. Ministry of Women and Child Development. Non-formal preschool education is for 0 to 6 years, no. You can't teach from 0, it is 3 to 6 years. Protein supplementation for a severely malnourished child is 20 to 25 grams per day, very important, correct. And supplementary nutrition is given for reproductive women also, no, there is no supplementary nutrition for reproductive women. Option C is very important, that is correct. See the target which is not a target for SDG 3. So out of 17 sustainable development goal, SDG 3 is for health. In that, the target which is not related to SDG, this was the question, MMR to less than 70 per 1000 livers, no. It is per 1 lakh livers, not per 1000. That is the answer, that is not the target. Neonatal mortality rate to 12, under 5 mortality rate to 25, these are all correct. Remember the numbers, MMR to less than 70 per 1 lakh, neonate 12, under 5 mortality rate 25 per 1000 live births. These questions are repeatedly asked in the exam. This is also a target in the global target of, or in the global epidemic of AIDS, TB and malaria, ATM, AIDS, TB and malaria. So we have given a PDF for you. These are the questions which has been posted on my Instagram page. PDF, some other answers are given, you can check it later. So the next question was, what is this instrument what is being shown? It is anemometer. What is the use of anemometer? To check the air velocity. Option C is the answer. Anemometer is used to check air velocity. The next question, again see the larva. One is Aedes, the second is Anopheles and the third is Culex. So Aedes, Anopheles, Culex. I am not asking you to identify. Everything is given. Identification I have mentioned Aedes, Anopheles and Culex. In that I am asking the breeding spots. Aedes artificial collection like broken bottles. Anopheles clean water. Culex dirty water, septic tank. Option A is the answer. Aedes artificial collection. Anopheles clean water. Culex dirty stagnant water. Which of the following is the disease caused by this vector? You can identify black white tiger mosquito. Na? Aedes. Answer is Zika. Out of the option, it is Zika. CCHF, heart tick, epidemic typhus, louse, Brugian filariasis. Brugian filariasis. The agent is Brugian malai and the vector is Mansonia. Bancroftian filariasis, Culex. Brugian filariasis, Mansonia mosquito. Aedes, Zika. Identification was important in that. Don't confuse this with housefly. This is black fly, responsible for river blindness. Black fly responsible for onchocerciasis or river blindness. So the next thing, because there was a trick in the question, actually the question was there is a disease related to Vision 2020 and this vector is responsible for that disease. That was the question. River blindness, the vector is black fly. The vector shown is responsible for all of the disease related to this except, so this is sand fly. Sand fly is not causing plantar ulcer. Sand fly will cause kala azar, oriental sore, varaya fever, and plantar ulcer is caused by sand flea, not sand fly. You can identify this. Hairy vector, upright wings, long legs. Hairs on the body, upright wings and long legs. Sandfly, colors are usually asked in the exam. This vector what you are seeing is sese fly. This vector what you are seeing is sese fly, responsible for African sleeping sickness. The question was what is used for sese fly control and what is that genetic method. This is the keyword. Genetic method used for sese fly control. Answer is SMR, sterile male release technique. Identify the genetic method in the option. That was the question which can be used for sese fly control. Very important question. SMR, sterile male release technique to control sese fly population. What is this green color powder? This is Paris green. Paris green is stomach poison, not nerve poison, it is stomach poison. Paris green in powder form. This was the question, to kill Anopheles larva because it is breeding on the surface. Surface breeder we use powders. For deep seated larva you can use granules. If the question is granules, then Culex and Aedes, but Paris green powder form mainly used. This will be the question, always repeated. Answer is Anopheles larva because stays on the surface. See, this polished rice is responsible for B1 deficiency. In some parts of our country, thiamine deficiency, that is responsible for beriberi. This was the question. Polished rice, B1 deficiency, what it can cause? It is causing beriberi, two types, dry and wet. What you are seeing is seen in pellagra, castle's necklace. The question was, if you consume jowar, there is chance of pellagra. What is the reason? That was the question. Answer is jowar is rich in leucine. Leucine excess will block the conversion from tryptophan to niacin. Excess of leucine will block the conversion from tryptophan to niacin. So there is no niacin synthesis. Jowar can cause pellagra because rich in leucine blocking the conversion. What you are seeing is acrodermatitis enteropathica. Acrodermatitis enteropathica, the lesions around that area, and this is seen in zinc deficiency. So what is this? It is a genetic disorder where the body is not absorbing zinc from the diet. You can see the lesions like this and there is growth failure also. How to prevent this? There is supplementation of zinc. Zinc supplementation can reduce the symptoms. The next question, when you are doing this technique, germination of pulses, what are the things which can increase? Out of the option, answer is riboflavin. It's a repeat question in the exam. Riboflavin content, that is B2 content, can increase after germination. Germination can increase some amount of riboflavin, niacin and also thiamine. So the question in the exam was having option of riboflavin, and that's a repeat MCQ in the exam. What is used in Anemia Mukt Bharat for a child of 7-year age? What is the color of the tablet? Any guess? The color of the tablet used is pink color tablet. Anemia Mukt Bharat, you should know the guidelines. See here, children aged 6 months to 5 years will be taking bi-weekly supplementation of 1 ml syrup. 1 ml has 20 mg elemental iron and 100 microgram folic acid. 100 microgram folic acid. 5 to 9, your question was 7 here, will take weekly once pink color tablet. 45 400, 45 400. Adolescent 10 to 19 will take weekly once blue color tablet. Dose is important, 60 500. In pregnancy, red color tablet daily from second trimester. Red color tablet dose is also same, 60 500. During pregnancy 6 months, after pregnancy 6 months. Total supplementation is 6 plus 6. Red color tablet daily once from second trimester. Dose is 60 500, 60 500. Reproductive women, iron folic acid, I am telling, not folic acid. Iron folic acid weekly once, red color tablet. So red is used in pregnancy and reproductive women, blue is used in adolescent. See this question, pulses are deficient in cysteine and methionine. These two are sulfur containing amino acids. Cysteine and methionine are sulfur containing amino acids. Pulses are deficient in these two amino acids. Sometimes they'll give soya bean, sometimes they will give green pulse like green peas. What is this mission? 25 by 22 under Poshan Abhiyan. See, this is the logo for Poshan Abhiyan. Mission 25 by 22 is related to stunting. What is 25 and what is 22? 22, you can guess it is the year. 25 is reduce the prevalence of stunting. Reduce the prevalence of stunting to 25%. Stunting will indicate chronic malnutrition. That prevalence has to come down to 25%. By which year? By last year, 2022. That was the target of Poshan Abhiyan related to stunting. This scheme, what you're saying, school children sitting in a circle, having a plate, having that meal, midday meal, this has been renamed as Pradhan Mantri Poshan scheme, or Pradhan Mantri Poshan Shakti Nirman. This is one more word where Pradhan Mantri is contributing something for school children also. Everywhere there is Pradhan Mantri nowadays, Pradhan Mantri schemes. So Pradhan Mantri Poshan Shakti Nirman is one more name given to midday meal scheme. Midday meal scheme is now under Ministry of Education. Previously it was called as Ministry of Human Resource Development. That was the old name. Very recently, last 2 years back, that name has been changed back to Ministry of Education. What was the older name? Ministry of Human Resource Development. Now it is Ministry of Education. Now it is Ministry of Education. What you are seeing is pasteurization. The question is, which is not used to check the efficiency of pasteurization? Answer is methylene blue reduction test. That is for eligibility, not efficiency, whether the milk what you are giving is ready or eligible for pasteurization or not for efficiency. Efficiency, we have 1 2 3 test: phosphatase, coliform and standard plate count. In this, the initial one is most commonly used. P for phosphatase test, P for pasteurization. That is the most commonly used test to check the efficiency of pasteurization. Methylene blue reduction test, MBR, is not for efficiency. What you are seeing is kesar dal. It's not kesar what you are checking, it's having that cover. Once you remove the cover, that dal looks like har dal. What you are having, har dal or kesar dal, almost looks same, saffron in color. And now in this image what is shown in the exams for you, that was having a cover. So once you remove that cover, you'll get that kesar dal. Good. Having that toxin boa, Lathyrus sativus, kesar dal is having the toxin boa. That boa is responsible for spasticity. This was the question. Boa responsible for spasticity. That one stick, two stick, and crawler stages, what you'll be seeing in neurolathyrism, one stick, two stick, and they need crawlers to move from place to place. That is due to this toxin boa, which is present in Lathyrus sativus. Kesar dal, kesar dal. What vitamin is used for prevention? Vitamin C can be used. See, this child is having bilateral pitting pedal edema. Bilateral pitting pedal edema, what you are seeing here. And this can be seen in which adult related disease? Epidemic dropsy. Epidemic dropsy. Epidemic dropsy is due to argemone oil which is mixed to mustard. Sarso ke sath, if I am adding argemone to mustard, that is the adult trend. What is the test done to check Argimon. My question is not most commonly done test. My question is most sensitive test. Most commonly done is nitric acid test, but most sensitive is PCT, paper chromatographic test. Isn't paper chromatography test is the most sensitive test to detect Argimon. What is this? Logo, Food Safety and Standards Authority of India. The minimum level of standards what all the Indian foods should follow is under which Ministry of Health and Family Welfare? Food safety, if they ask this question, answer is Ministry of Health and Family Welfare should take care of this. Which of the following is false for the image shown below? Shakir's tape is used. Mid upper arm circumference is checked. Yes, correct. Child is severely malnourished. No, you are seeing that yellow color. The child is moderately malnourished. If it goes to red, then it is severely malnourished. Very small arm, red color, severely malnourished. It is moderately malnourished. MUAC is age independent anthropometric measure. That is also correct option. So the child is having moderate malnourishment. How to classify? Remember the numbers 11.5 to 12.5. This is the newer update. 11.5 to 12.5. More than this is green, less than this is red. So anything in between is yellow. Traffic signal you can remember, but the waiting zone you have to know. Yellow color is between 11.5 centimeter to 12.5 centimeter. Less than that, red color, severe malnourishment. Your question was on moderate malnourishment. Anything above 12.5 is green. Remember the waiting zone 11.5 to 12.5. Yellow color, traffic signal. Good. The quality standard what you are seeing, it is Indian Standard Institute, ISI. Standards on any food. ISA has been renamed now. It is given a new name, that is Bureau of Indian Standards. Bureau of Indian Standards. This is the newer institute. Previously it was called as ISI, Indian Standards Institute. Next question is on iodized salt. The concentration of iodine to be used at consumer level, if this is the question, answer is 15 ppm. Production level 30, consumer level we keep 15. So because during transport it has to reduce, so we cannot keep it at 30. Production level 30 is the quality standard what we keep. At consumer level, answer is 15 ppm has to be given, because the RD of iodine in adult is 150 microgram. If I consume 10 gram of salt on an average, if 1 gram has 15 ppm, 10 into 15, 150 microgram is fulfilled. That is the RDA of iodine at consumer level. Which of the following is a preventive measure for this? As you can see here, these are severe forms of dental fluorosis. What they are observing is dental fluorosis on incisors. We have to remove fluorine. Nalgonda technique. Dental mottling, white chalky patches has gone to the next level, and it has crossed, and it is causing brownish discoloration in the incisors. Prevention is Nalgonda, defluoridation of water. What you are seeing here is saying, like if I am telling the test finding is precise but not accurate. So which will suit for this? So precision is giving the same values but not measuring the central value. If the patient hemoglobin is 10 grams, patient hemoglobin in the center is 10 grams, but your test is telling 12.1, 12.2, 12.1 like that. It is almost precise, giving the same values, but on an average it is not measuring the actual value for the patient. So image C will suit that. Precise but not accurate. Precise but not accurate. See here, very important thing. What you are having is, if I am keeping a cutoff at 50, and these patients are having disease cancer, and anyone who is having value of more than 50 as per your screening test, the reality is that, but your screening test if you are doing and keeping the unit at 50, what will happen, these will be classified as disease true positives, and that is sensitivity of this test. Anyone who is having value less than this in the normal individuals will be classified as normal, true negatives, and this is specificity of a test. Having cancer not identified, false negatives. Normal individual wrongly classified as disease, false positives, false positives. This is the basic. My question is, if I make a cutoff and if I change it to 40, if I change it to 40, see here, if I change it to 40, You will identify all the cancer patients. This will become highly sensitive test. Sensitivity will increase, but what will decrease? Specificity will decrease. This is the question. If I take at 50, you are seeing four things: true positives, true negatives. Not identified false negatives, wrongly identified false positives. That is the easiest question. But I change the question to the next level. If I reduce the cutoff, everyone is identified. If I keep it at 40 units, will do justice for the cancer patients. All true positives, 100% sensitivity, but you are sacrificing specificity. The answer is sensitivity will increase. If you reduce the cutoff, keep this in mind, sensitivity will increase. What is this? What you are seeing is ROC curve. ROC curve is the ratio between true positive and false positive of a test. Relation between sensitivity and 1 minus specificity, true positives and false positives. So this thing, what you are seeing, the shoulder of the test, like test A, B and C, the shoulder will indicate the performance. ROC curve is used to indicate performance, correct. Graph between true positives and false positives, correct. Test A is having better performance than B, correct. You can see the true positivity in test A and the corresponding false positive thing. So test A is better than test B, that is correct. But if I am asking test A is having 100% sensitivity, no. 100% sensitivity is for this point. 100% sensitivity and 100% specificity, because there is 100% true positive result and 0 false positive result. 100% true positives and 0 false positive result. So which is having 100% sensitivity, 100% specificity, then your point C. This is the ideal point, not usually possible. So which test is better than this? If I am comparing A and B, A is better. So test A is better than B, but test A is not ideal. Test C performance ideal, because C has 100% true positive result and 0 false positive result. Keep this in mind. I'm going in a rapid revision mode because all these things have been discussed in your Instagram page and classes. So this session is just to give that mop-up part, brush up, mop-up sessions. So the questions have been posted in your Instagram handle, and just it is a revision purpose what we are doing. The question is telling mean, median, mode values are given. Mean, median, mode, if this is the sequence, mean, median, mode, if this is the sequence, mode is highest, then the answer is left skewness. That is also called as negatively skewed data. For this data, which curve suits? If I am telling B is normal distribution, C is negatively skewed data, A is positively skewed data, depending on the tailing towards left side, negative skewness, tailing towards right side, positive skewness. Proper symmetrical data, that is B. So if mean, median, mode is given, always remember, if everything is there in the center and coinciding, that means there is no skewness, normal distribution. If I give the values like this, 1 2 3 4 5 6 7, give the horizontal values. So if mode is least and mean is highest, mode is least and mean is highest, then it is right skewed data. But your question is opposite. Mode was highest, mean was least. Mode was highest, mean was least. That is why it is left skewed data. You have to give the values in the horizontal axis. 1 2 3 4 5 6 7 8 or 10 20 30 40 50. Then you will come to know and how to interpret the curve properly. Now repeat. Mode is highest, left skewed data. Mode is least, right skewed data. So the skewness is given by the mean. Mean will represent tail. Mean is highest, right skewed data. Mean is least, left skewed data. The tailing is towards the side. Tailing will indicate mean. Peak is mode. Always remember, peak is mode. The tail is mean in the data. The tail is mean in the data. Good. Next question. Which of the following is false for the image? So listen, both are normal distribution curves, correct? And when you take the center, this is mean. Mean is 50 for both the curves. Mean is same for both the curves with different standard deviation, that is also correct. Standard deviation of B is more than A, correct. See, B is having more width. You can see the width of the curve compared to A. B is having more width, so it is having more deviation. Option D is wrong. Mean is different with same ST. No. Mean is same but ST is different. What is standard deviation? If this is and if this is, two curves are given, B and A, which is having a wider data, that is dispersion. B is having more dispersion compared to A. That was the question. Mean was same but dispersion was different. See this question. These are scatter plots, correlation plots. All are showing positive plots. No, D is having no correlation. If I'm arranging the correlation plots in a proper way, listen, plot A is showing perfect linear correlation, correct. There is no spread. That straight line, what you are saying, perfect linear correlation. If I am taking correlation coefficient, it is +1 for this. Perfect linear positive correlation. This is not perfect linear. There is some scattering around. But this is also not perfect linear. There is some scattering around. Both are showing positive correlation. The correlation coefficient can range from 0 to +1. In both the curves, it can range from 0 to +1. D is showing no correlation. Correlation coefficient of B is between 0 to +1, correct. Plot D is showing no correlation, correct. C is ranging from 0 to -1, no. C is ranging from 0 to +1. So this is perfect linearity. These two are not perfect linear, can range from 0 to +1. D is having no correlation. See this question. There are three samples. And the question was X, Y, Z are three graphs for the study done in three samples. All are showing normal distribution, correct, with one mean in the center. That is also correct. Mean is different for all the curves. No. Mean is same for all the curves in the center. Now check the spread of the data. Previous question we have discussed. Check the spread of the data. Standard deviation is more for Z. See here, standard deviation is more for Z. So standard deviation of X is more than Y. No, this is also wrong. X is less than Y. See here, standard deviation X, Y, Z. So X, Y, Z. Z is having more spread. So X, Y, Z, this is the deviation. So next is standard deviation and sample size relation you have to know. The question was a bit difficult. Always keep this in mind. Standard deviation is inversely proportional to sample size. This was the trick in the question. As you know, the formula of standard deviation and sample size are inversely related. Now if standard deviation sequence is like this, make a sequence for sample size. Just opposite. Sample size sequence is just opposite. Good. These two sequences you should know. First make a sequence of deviation or spread, then just opposite sequences for sample size. Which is having highest sample size X, which is having least sample size Z. Now come to the option. Sample size of Z is more than Y. No. That means option D has to be correct. Sample size of X is more than Y, correct. So which is having highest dispersion? X. Which is having highest dispersion? Listen, which is having highest dispersion? Z. Which is having highest sample size? X. Which is having highest dispersion? Z. Which is having highest sample size? X. So come to the next question. See this question, very easy. Identify the sampling method shown in the image. You are having three groups, all represented by three different colors. These are called as strata. Means three different subgroups. Based on those three different subgroups, within this you are selecting one, within this you are selecting two, within this you are selecting one. Means according to their sizes, you are selecting the individuals randomly. First you are making three different subgroups, then according to their sizes, individuals are selected randomly. Answer is stratified random sampling. Cluster means clusters are selected randomly. The final sampling unit is not individual. Here the final sampling unit is individuals. That is why it is stratified random sampling, not cluster. Cluster we select clusters randomly. Keep this in mind. Clusters randomly. Good. Come to the next question. Answer what you are seeing here. Burtonian lines on the gums. Burtonian lines. This is basophilic stippling of RBCs, basophilic stippling of RBCs, and this is dense metaphyseal lines. Dense metaphyseal lines. All these are features of lead poisoning. Repeat. Burtonian lines, basophilic stippling of RBCs, and dense metaphyseal lines seen in exposure to paint industry. Where lead is used, if I am asking, lead is used in paint, battery manufacturers and automobile exhaust. Battery manufacturers, paint, and even in automobile exhaust you can see lead exposure. Out of the option it was for paint industry. Which of the following is false for the lung disease associated with sugarcane waste? Sugarcane waste, bagasosis, first identified in cardboard industry, correct. Due to thermophilic actinomycetes, correct. What is the specific species named? Thermoactinomyces saccharide. That is the specific species. That thermophilic actinomycetes has been given the name thermophilic or thermoactinomyces saccharide. That is the exact species. It's a type of thermophilic actinomycete. That fungus can be killed by using 2% propionic acid, that is used for prevention. If they ask notifiable disease, no. Bagasosis is not notifiable. Bicinosis is notifiable. Asbestosis is notifiable. Silicosis is notifiable. Remember, silicosis, asbestosis, bicinosis, SAB, but not B for bagasosis is not notifiable. Very, very important question. Next question was showing pleural plaques. The keyword was shipyard industry. Pleural plaques, some haziness, ground glass in the basal lung fields. So shipyard, base is involved, pleural plaques what you are seeing. So all these are going in favor of asbestos exposure, asbestosis. Silicosis, they will give stone cutting industry, apex is involved, like that they will frame a question. Stone cutters, the apex is involved in silicosis, base is involved in asbestosis. See the next question. Which is true for the benefit given for sterilization purpose in this scheme for males? ESI scheme, males, vasectomy. Answer is option A. Vasectomy, full wage. You are not giving any percentage. How many days of leave? 7 days. 7 days of leave, full wages are given for vasectomy. If I am asking for females, it is tubectomy, 14 days. If I make the question females, then it is 14 days. F for female, F for 14, then it is tubectomy, full wage. So the question was specifically males. Option A is the correct answer. Option A is the correct answer. What you are seeing is how they are interacting. You are sitting in a circle, you are making them to sit in a circle and showing the interaction. Like A is not participating in the discussions either, sitting simply, not participating in the discussion. This interaction is seen after focused group discussion. What is this called as? This is a sociogram. What you are making, this is a sociogram. Sociogram is showing interaction among participants, in focused group discussion. Focused group discussion. Antara. Which of the following is false for this contraceptive? It is progesterone based, correct. It is DMPA. Injectable contraceptive, correct. Used once in 3 months. Important. The gap is 3 months. That is what is Antara. Antara means gap, 3 months. Failure rate is 0.3 per 100 women years. Note down this point, you'll make mistake here. Pearl index, failure rate 0.3 per 100 women years. Not suitable for breastfeeding women. No. It is suitable for lactating women. So from 6 weeks after delivery we start DMPA injection. It is suitable for lactating women. The logical sequence of event as shown in the image. This is showing how we have to start and how we have to go. For every activity starting from this point to this point, how many months it will take to finish the event. This is the logical sequence of event called as PERT. What is the use of PERT? To assess the time taken for an activity. What is the full form? Program Evaluation and Review Technique. The logical sequence of events and how much time it is taking for one node to next node or one step to next step. It is a type of network analysis. It is a repeat question. PERT is a type of network analysis. PERT is a type of network analysis. When the patient is there with dog bite, you are teaching them how to wash dog bite wound, which is the health education method. No need to dance and no need to go for lecture. Role play is not necessary. Oh, and all you are showing not necessary. Delphi is too much. That is for decision making by experts, not related to this. It is just the demonstration. If you want to teach them some skills, how to make ORS, how to use it, or how to wash the wounds, demonstration is sufficient. Demonstration is sufficient. No need for role play and waste some time in that. So the waste shown below, swabs, what you are seeing, soiled swabs, yellow, metallic implants, blue. Search the answer. This will go in yellow, soil swabs, cotton swabs, metallic implants, blue box. Answer is option B. The next question was, there is mercury spillage, thermometer broken. Now the broken glass will go in blue. Broken glass will go in blue bag, blue box, and the mercury what you are having. So collect it using cardboard sheets or X-ray sheets. Then dispose into a container with water. Collection and disposal. Cardboard sheets what you are using. Answer is option C. Mercury spillage. But the broken glass will go in blue bag, blue broken glass. Mercury cardboard sheets. What you are seeing? Thoda sa difficult question. The answer is ionizing radiation. The answer is ionizing radiation. The logo shown below is for ionizing radiation. So this was the repeated question. What is ionizing radiation? You can read it later in the PDF what I am giving for you. This logo is for ionizing radiation related to biomedical waste. The toxicity level of this label for a pesticide. So pesticide toxicity colors are important. Yellow color will indicate highly toxic pesticide. So what are the colors used for pesticide toxicity? See here, red, extremely toxic; yellow, highly toxic; blue, moderately toxic; green, slightly toxic. So these four colors might have come across that scheme PMSM, na Pradhan Mantri Surakshit Matritva Abhiyan, almost same colors, red, green, yellow, blue. Here also it is, just remember R, Y, then you keep B and G. Which is extremely toxic, red; highly toxic was the option, yellow; moderately toxic, blue; slightly toxic, green. Green is slightly toxic, not toxic. Not toxic is not in the option. It has to be some toxicity, and toxicity levels are being graded like this. Lethal dose, if I am asking, can be asked in the future exams. Note down the numbers. Note down the numbers. In that, note down the lethal dose for red color poison. That is enough. No need to remember everything, because it's not possible for you to recall everything in the exam. You have to take a wild guess. You have to take a risk. Sometimes you have to remember very important thing. I made the question a bit difficult for you by giving yellow color. It is highly toxic, not extremely toxic. What is that color given for extremely toxic? You can guess. Red. Red means something dangerous. Something dangerous. Good. Red roses and all will be knowing now. Good. So question number 98. ORS packets what you are using in healthcare. There are four principles of primary healthcare what is shown here: appropriate technology, community participation, equitable distribution, intersectoral coordination. These are four principles of primary healthcare. The mnemonic is ACE inhibitors. Very good. ORS will come under appropriate technology. Answer is correct. Affordable, easy to use. Affordable, easy to use. Acceptable to the population. That is also very important. That affordability and acceptability is very important when you are selling any product. ORS is very much affordable. Sometimes it is affordable outside also, 1 rupees 2 rupees per packet if it is given. Health centers it is free of cost. Yes. and it is acceptable because it is easy to use. That is why they are accepting that it comes under appropriate technology. See the next question. Which of the following is not the contribution under the organization shown? Though that's a difficult question. UNICEF is the organization what I'm showing. You can see mother and child. So it is UNICEF. Full form is United Nations Children's Fund. Itna hi hai. It is just United Nations Children's Fund, not International Children Emergency Fund. It is United Nations Children's Fund. Gobi Triple F campaign is a part of that. Yes, correct. What is Gobi? Triple F campaign, growth charts, ORS, breastfeeding, immunization, food supplements, family planning, and female empowerment. Food supplements, family planning, and female empowerment. Country health programming means it is related to overall development of a child, starting from birth till the adolescent phase, overall development of a child. Applied nutrition program, very important, where you put school gardens, where you promote them to grow their own vegetables and schools, funded mainly by UNICEF, the infrastructure part. Freedom for hunger, freedom from hunger. This is promoted by FAO, Food and Agricultural Organization, not related to UNICEF. Identify and note this question. What is a difficult question? Intentionally I framed this question because last 2 years they've asked question on UNICEF, so I am making the question difficult. Repeat 1, 2, 3. Gobi Triple F, Country Health Programming, and Applied Nutrition Program is a previous year question. Freedom from hunger, food and agricultural organization will promote that. Nobody should die of hunger. The last question, the image based question for you was on WHO. Which of the following is not the function of WHO? Preventing diseases important, family health focus, research is very important part of WHO. Conducting census is not related to WHO. Census is under Ministry of Home Affairs. Home Affairs will take care of census, not related to WHO. What are the functions of WHO? That can be a future MCQ in the exams. Controlling disease, family health, health services to be provided, environment, research, health statistics, literature, the records what they have to keep, and cooperation with other organization. This is very important list. Functions of WHO. Functions of WHO. Who will conduct census? Which ministry? Ministry of Home Affairs will take care of census in our country. So total 100 image based question in this video. So our purpose was to finish it within 60 minutes because it is just a rapid revision session. I don't want to waste your time by making it lengthy 4-5 hours. Not possible at the point of exams to revise that much. So I was focusing more on less than 60-minute part, and it was just focusing on all the keywords because questions have been posted in your Instagram page. I've been posting my questions in my Instagram page, Rajiv Shetty, and the PDFs have been given to you already in the Instagram page and link. This was, once you have that PDF, and with the PDF if you have this video, that will be very easy for you because one is telling you something to focus on that. So that will be very good, and in the exam that will help in proper recall also. So for this year NEET exams, we are focused on PYQs. That video has been given already in the YouTube channel. And again, IBQs video, this is the video within 60 minutes where I have summarized all the image based questions which are important based on the previous year exams. So it was just a rapid recall session finishing within 60 minutes. Again, thanks for being a part of our journey. It was just a journey with you and me in that Instagram handle, posting questions since 3 months, and you are answering it daily. Thanks for supporting and answering in that way also. And it was just a suffer and the journey what we are going together, and we are blessed to be a part of your journey. Like we have a song, na Safar ka tha man, Safar ka raha. Thank you for being a part of our journey. And smiley from my side also. Take this. All the best wishes for your exams. Thank you so much. All the best.